Okay, so Module 1, we are going to be discussing what is a nurse, what is the function of a nurse, the ethical responsibilities of a nurse, what is professionalism when we're assessing a patient, what do we think about when we're doing the Maslow's safety, any risk factors. We're going to talk about a little bit about health promotion. So let's get started. So I want you to think about, what is nursing? What is nursing to you? What is a nurse? In my perception, I think a nurse is a person that cares. They're a patient's advocate. They are educators. They're gentle. They are leaders. They support their patients and support their coworkers. They are dedicated. They're kind. They're nurturers. They give them all to their patients. So comforting, like we talked about. They're also smart. They're respected. Nurses are respected. Patients look up to us. They look at us and they look for guidance. They look for comfort because that's what nursing does. So according to the American Nurses Association in 2010, they stated that the nursing practice is individualized. So it's individualized. I will care for a patient in the emergency department the same as another patient I have in the emergency department, but their care will be individualized. Their care is going, in a way, it will be similar, but depends on what they come in for. Okay. Nurses care by establishing partnerships. That goes along with other healthcare workers and with their patients. We have to build this therapeutic rapport with our clients, and because they need to trust us. They need to be able to give us all the information that they can so we can care for them better. Nursing practice, caring is central to the practice of the RN. So, nurses, we care. There is a purpose on why we're doing this. Money is not the reason, okay? So if you're coming in this for the money reason, you got to rethink this. Because when you get into practice, when you get into clinicals, it's going to be hard. You can't. Nurses really do care. We put a stamp on the practice that we give. We put a stamp on what we do with our clients. So we use the nursing process to plan and provide individual care to our healthcare clients. So we assess each one of our clients. We find their priority problem, which is their nursing diagnosis. Then we plan care with them. Okay, the patient is always included while we're doing the nursing process. We collaborate a plan of care. Then that care that we just planned, we implement it. We put it into action. And then after we're done with those interventions, we then evaluate. Okay, how did that work? Let's say it's a patient that comes in for a headache. Okay, we initially dimmed the lights. We gave them a pillow. We repositioned them. Maybe we put a cold pack behind their head. Those are all nursing interventions. Then I reevaluate them. They still state that their pain is still a 10 out of 10 and that it didn't work. Okay, now my nursing interventions didn't work. Now I get to reassess, so I get to go back to A for ADPI in the nursing process, and I get to figure out, okay, what didn't work, why didn't it work, what can I do differently? So I then do the priority problem again, and then I plan again, and then I implement. So maybe this time I do 1,000 milligrams of Tylenol, or I do 600 of Motrin. So there is a strong link that exists between the professional work environment and the nurse's ability to provide quality health care and achieve optimal outcomes. So nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, groups, communities, and populations. So roles and function as a nurse. So we are all of these. When you become a nurse and as throughout school, you're going to develop all these skills. You're going to become an advocate, an advocate. You're going to become a counselor. You're going to use those critical thinking skills. You're going to understand what it means about being detailed oriented. If you think you're detailed oriented now, just wait until you see a medication order. Just wait until you have to do a procedure. There's so many little details, and you have to be particular with those details because it's about patient safety. Physical stamina. If you're morbidly obese and you just can't work, or if you are really skinny and if you're physically unfit, okay, you just can't do a 12-hour shift, rethink this, okay? Rethink about, okay, I need to change something because I love nursing. I need to change something. You have to be emotionally stable. There's going to be times where you see patients that pass away right in front of you. There's going to be times when I work in the emergency department, and there's been numerous times where ambulance brings in a mom who just delivered her stillborn baby. Am I emotional about this? Yes, because I'm human. I'm a human being. I have emotions. I'm a person. That's why I'm a nurse, because I have emotions and I care. I have to be emotionally stable for this mother. Now, does that mean I can go in the break room and bawl my eyes out? Totally. I could totally do that because it is reasonable, okay, to let your emotions out. You can't bottle them up because if you bottle them up, they're going to stay in there for a long time and then you're going to burst like a bubble. I'm going to be a leader, okay? I'm patient. I'm competent in what I'm doing. I'm a listener. I'm a team player. I'm respectful to my coworkers, to my classmates, to my other didactic instructors. I'm respectful, and that's a team player. I listen. These are all roles and functions as a nurse. Then there's ethical responsibilities of nurses. I would like you to look these up. We're going to talk about these in class next week. Basic principles. So take a look at these. Think of an example. This is all in your ATI book, Chapter 3. And then think about the ethical principles. What are these? What do they mean? Give me an example on these. And we'll talk about it more in class. Be prepared to present. Now, ethical dilemmas. You will have these. Okay? When is right, and when is wrong right? And can wrong ever be right? So there's the morality and the science, okay? There's a conflict sometimes. So how do we make an ethical decision? So we identify whether the issue is an ethical dilemma. Can you just be uncomfortable or are you biased? There's a lot of things that I feel uncomfortable with, but I have to think about, okay, I'm just a little uncomfortable with this, but I'm not biased against it. Reflect on your own values. State the dilemma. List and analyze all possible options and review the implications. Apply the decision to the dilemma and evaluate the outcome. Just like ADPI, you're assessing the dilemma, okay? The ADPI is the nursing process. You're assessing the dilemma. Okay, you're reflecting on your own values. You're reflecting on, does this make you uncomfortable? Are you biased? Okay, do you need to remove yourself? There's all these factors. Then you're going to state dilemma. Okay, that is the kind of like the nursing diagnosis. This is just like ADPI. Then you're going to list and analyze all the possible options. Options. So you're going to do your planning and then you're going to implement it and you're going to evaluate the outcome. So ethical guidelines, the nurses are regulated by individual state statutes and rules, otherwise known as the Nurse Practice Act. So the licensure, every nurse must have a current license in every state that they wish to practice in. So according to Arizona, we are a compact state. So that means other states that are compact states we can work in. We just have to show documentation and follow their protocols. So let's do a question. So here is a typical NCLEX style question that you may see. So, a nurse offers pain medication to a client who is post-operative prior to ambulation. The nurse understands that this aspect of care delivery is an example of which of the following ethical principles. So, you should have looked them up and got an example to answer this question. So, let's look at this. It's asking, okay, so you have a patient that needs pain medication. They're a post-op patient. They need to ambulate. So which ethical principle is this an example of? Fidelity, autonomy, justice, or benefits? What do you think? Okay, so it is D. It is the action that promotes good for others without any self-interest. So, if you need some clarification, go to ATI Chapter 3. So let's talk about this. Do you think is nursing a profession or is it a job? Okay. Specialized education, we got it. Code of ethics. Yes, nursing has their own code of ethics. Do we have a body of research? Absolutely. Evidence-based practice is always used. Do we have a licensure? Yes. Self-regulation? Absolutely. Do nurses have autonomy? Yes. Are they competent? Performance required? Absolutely. A common culture? Yes. Nursing is a profession. It is not just a job. A job you can get anywhere, okay, without education. Nursing is a profession. In your book, it was talking about this, I can't remember what it was, but it was talking about the difference between a profession and a job. And these are all the qualifications of a profession, and nursing has it. So, regulation of nursing practice. So here's a typical question as well. Which organization is directly responsible for regulating the practice of nursing in each state? So first, read the question, then read your possible answers, and then read the question again. Which one do you think it is? It is the State Board of Nursing. The state legislature enacts the Nurse Practice Act. The NPA creates a Board of Nursing. The Board of Nursing in each state is charged with regulating the practice of nursing. So I would like you to review the Nurse Practice Act. Okay, this is the link. So each state board is responsible for defining the practice of professional nursing. They're responsible also for the scope of practice for nursing, activities that the nurses are expected to perform, approving nursing education programs, develop rules and regulation for guidelines to nurses, enforce the rules, and govern nursing practice. Okay, the Board of Nursing is not your friend. They regulate. They are your regulation, okay? So keep that in mind. You must know what is within your scope of practice. What I do in the emergency department, I cannot do here. What I do in the emergency department at Banner Estrella versus Good Sam, they are different because it all depends on that. Honestly, it depends on that hospital too. So the hospitals also have standards of care that they need to fulfill. So I might go to work at Dignity and I might be able to have more autonomy over there than I might be at Banner, or vice versa. You have to know what the state allows you to do and then also what your facility allows you to do. So standards of practice, like we talked about, standards of care. So according to the ANA, it is described a competent level of nursing care as demonstrated by the critical thinking model known as the nursing process. So it provides a guide to the knowledge, skills, and attitudes. You'll hear those are KSAs that nurses must incorporate into their practice to provide safe, quality care. So let's go to your book, okay? Your book is all about thinking, doing, and caring. and that is so ideal for nursing. So it's called the safe, effective nursing care. So provide goal-oriented and client-centered care. So you establish mutual goals with the clients. You show respect to them, especially if they have different religious beliefs or if they have different cultural beliefs. And you implement the interventions to promote client care and optimal health. That is what nursing does. Then we're going to collaborate also with interprofessional healthcare teams. You're going to develop the comprehensive plan of client care, okay? You're going to talk with other healthcare professionals and develop a plan of care for them. Now, the patient is always the center of that care. They have to be included on this. We're going to validate evidence-based research to incorporate into practice. Evidence-based findings now have really helped drive optimal care for clients. So, for instance, the Foley catheters. A Foley catheter goes into the urethra and it collects the urine out of the bladder, so the patient doesn't need to go pee in the bathroom. Now, it used to be that everyone gets one. Just be convenient, just everyone gets one. Evidence-based practice actually showed, or evidence-based research showed that having a Foley catheter in for a long period of time introduced more bacteria and actually was causing patients to go into urosepsis, which is, they were really sick. So sepsis is a very sick state of the body. Not to go too details, but they were seeing all these trends and how patients were getting more sicker. So now you can only put a Foley in if it's absolutely necessary. So for surgeries, if the patient is a neurogenic bladder, those are the reasons. So then we're going to provide safe, quality client care. So doing the holistic approach. We're going to be thinking, doing, and caring, okay? So we're doing nursing interventions. You have to think about, okay, what's the difference between nursing and medical? Nursing is non-invasive. Medical, they really they diagnose and treat that client. When we're looking at nursing, we're looking at the whole picture. We're looking at holistically. We're trying to use techniques to avoid medical or nursing errors in the delivery of the client care. Embrace and incorporate technological advances. So technology is great. It has saved many people's lives because of the advances we have nowadays. But be very careful with that technology, and you need to remain current with the technology changes because they change pretty frequently. Thinking skills. So you're going to start developing clinical judgment. You're observing, you're comparing, contrasting, evaluating the client's condition. You're going to start learning what is a baseline and then what is different than a baseline. So in our class, we're all pretty healthy. This is your baseline. So then when you go out into practice, you'll notice, oh, that is not a baseline. That is something abnormal. So you're going to compare and contrast. Clinical thinking and reflective thinking. So you're going to be analyzing all the information, considering options for the action. So thinking about the ADPI, that is clinical thinking. You're assessing them, you're collecting the data, you're finding the primary problem, then you're planning care for them, then you would implement that care, and then you're going to evaluate it. Problem solving, okay? All of us problem solve. It's, so just like how it says, attempting to find a satisfactory solution. That is what we do with our clients. We are trying to make sure that we find a solution for them to help them. So then when they leave us, they can continue implementing these plan of cares to improve that solution. So let's talk about the nursing process, where you're going to use the nursing process throughout your entire nursing career. It is a systematic approach to assist for the nursing practice. You'll hear it as ADPI. So ADPI stands for assessment. This is when you're gathering all the information. It can be subjective data, objective data, Subjective data is what the client is stating to you, such as, I have a pain level of 9 out of 10. Objective data is the data that you're observing. So when you walk into the room, you're observing if they are grimacing and holding their abdomen or their chest. Something like that. You're also reviewing their medical history. You're gathering all that data. After you gather all that data, you're going to analyze and find the diagnose. Now, this is not a medical diagnosis, this is a nursing diagnose. So you're finding that priority problem and you're identifying their entirety of their problems that they have that they are presenting to you with. Next, you're going to plan. Now you have all your assessment done, you've found your priority problems, and now you're going to plan. You're going to develop some SMART goals. SMART goals are specific, measurable, attainable, realistic, and time frames. Okay, they have to be timely. These are goals you're going to develop with your client. They're going to have desired outcomes. They're going to have an action plan. So let's do one. We have a client that comes in. He comes into your emergency department. Okay. He comes in with a headache. All right. So he has a headache. His subjective data is it's a 9 out of 10 pain. It's throbbing pain. It's a gradual onset. He has a history of migraines. All right. Your objective data for this client will be he is closing his eyes, he has sunglasses on, he has photophobia. So the lights bother his eyes. It makes the headache worse. So a SMART goal for him is, okay, I'm thinking nursing interventions first. So a nursing intervention SMART goal I can think of for him is the client will have a pain level less than 4 in 1 hour after, and then think of a nursing intervention to do for them. So initially we could do a cold pack behind their head. We could dim the lights, reposition them, hydrate them. Okay, those are all basic nursing interventions. Now, if those nursing interventions are not working, then we have to reevaluate them. But we have to first implement them. Okay, so now we just plan the goals. Now we're going to implement them. So we talked about his pain level would go from a 9 to less than a 4 within 1 hour after we implemented the following that we just talked about. Now, after we've implemented them and we had that time frame, that 1 hour time frame, now after that hour, I'm going to come back and evaluate him. Were the desired outcomes and goals achieved? Did we meet his pain level? That was the goal. And we didn't, okay? For this gentleman, we didn't. So now I have to go back to assessment, gather more information, figure out why didn't it work? Okay, did any of them work? He may say the lights being off worked, but he's still like an 8. So, but he never met that 4. So now you have to redo ADPI, okay? Make a new goal, implement it, reevaluate it. So with our care, we have to prioritize our care. You will have at times 2 patients, 1 patient, maybe 6. You have to prioritize your care. So which client are you going to see first? What is the most important assessment finding? Which intervention should you perform first? What is the proper sequence of steps when performing the procedure? Situations that pose immediate risk to the client's safety. Tasks appropriate to delegate. These are all things you need to think about when you're prioritizing. There's tasks that we need to do, but we can delegate those tasks. So if we have a nursing assistant that is able to do vital signs, I'm going to delegate vital signs to this client, to this CNA that can do it on stable clients. Okay, you can only delegate to stable clients. Okay. And you must know also the person you're delegating to, is this task within their scope of practice as well? So to go along with the priorities and prioritization, we think of ABCs. This is a priority of your initial assessment. You are assessing your client airway, breathing, circulation. If there's an alteration in any one of these, there could be and indicate a threat to life. Okay, so you're walking into your room. How do I know if my patient's breathing? Their chest is rising and falling. They look pink. They don't look cyanotic, which is blue. They have a good circulation. They're looking at me. They're not altered. Okay, there's all these different factors. They're not hunched down on the floor. All right, so they're breathing easily. All right, up and down. Now we're going to look at Maslow's hierarchy of needs. So this is probably just a little review, but we're going to go through it. So you know and remember that we have to start from the bottom to get to the top. You always start from the bottom to get to the top. Everything in life. So first we need air, water, food, shelter. I work in the emergency department and I see a lot of clients come into the ER who need this physiological needs. They don't have water. They don't have food. They have nowhere to sleep. Their clothing is nasty. They have rips and holes and dirt on their clothing. The reproduction is all off, okay? They have nowhere to go. So first we need to fix this before we can go and move on to safety needs. So who can I contact? There's multiple people we can contact. We have case managers, we have social workers. They can assist in finding shelters, finding food. Let's talk about elderly clients. Elderly clients, they're usually on a fixed income, all right? Now, if they're having a physiological need with water and food, maybe they need to go on Meals on Wheels. That's a great external resource we can give them. Now, the next one is safety needs. So, personal security, employment, resources, health, and property. So, a lot of times people are stuck in this one because they're trying to find good employment, good resources, property. Now, if they're able to succeed on this one, then they go up to love and belonging. Do they have friendships? Are they having that intimacy? Do they have a sense of connection or a family? Once they achieve this, they go to esteem. Now, this is self-respect, self-esteem, status. They have a status. Recognition, strength, there's freedom, autonomy. And then the highest one is self-actualization. It's a desire to become the most that one can be. So you're going way beyond. You're achieving those dreams that you have. Just like you guys are in school. You're in nursing school now. You have achieved so many goals so far that now you're in core. A lot of people don't get this far. Another thing to keep in mind is safety and risk reduction. So we have to think and do a risk assessment on our clients. How are they walking? What is the greatest risk to the client? What is the significance of risk compared to other risk? So you have to assign the priority to the factor of the situation posing the greatest risk. Okay, just like what we said. Assess for external or any internal factors. Sources of safety issues, so the client, the nurse, the provider, those are all external. Abnormal lab values or vital signs, those are all internal safety issues. We use ABC combined with the safety and risk reduction always. Now, when we're taking care of our clients, we want to do least restrictive and least invasive. I'm not going to go and grab an IV and stick it in someone's arm if I think they're dehydrated, but they're fully awake and they can drink water. I will tell you in the ED, in my practice, and in the practice of the other nurses that I work with, we will put an IV in majority of our patients, but if there's a patient that comes in and there's no reason why we should do an IV, because IVs primarily we need to use those appropriately. Give them fluids, help them hydrate. Now, if a client is fully awake and they're able to have PO, as in oral fluids, I'm going to push oral fluids on them because then it's least invasive, okay? If they have an IV in their arm, they're at risk for infection. They're at risk for getting phlebitis, infiltration. And then they have another problem, okay? I don't want to cause another problem if I can help it. So always go to the interventions that are least restrictive and invasive to your client. Make sure it won't put the client at risk for harm of injury. That is the biggest thing. We have to keep them safe. So let's talk about restraints. Again, I'm in the ER. We have psychiatric patients. We have combative patients a lot. We have to restrain them at times. But I have to do the least restrictive and the least invasive first. And do not forget to document this. You have to document everything you do. If I did these therapeutic communication or therapeutic nursing interventions first, document it. And then if you absolutely have to, the last resort is a restraint. Why? Because restraints can cause injury. It's non-therapeutic. Same thing with Foley's. If you put a Foley in someone's bladder, you're creating a foreign body that stays in there, and it's actually going to cause bacteria to kind of harbor in that area where the Foley is exiting. Yeah, female and a male. And if they get a UTI, now they're on antibiotics. Those antibiotics, they can develop C. diff, which is a pretty severe GI infection. Now, you just have to really think about the safety of your client. So going back to the ABCs, your Maslow's, safety and risk reduction, and the least restrictive and least invasive, combined all these, and this is how you're going to prioritize your patient, okay? The first initial assessment you're going to do is your ABCs, airway, breathing, circulation. So now we're going to do a question. So when using the nursing process priority setting framework, the nurse should always remember to do which of the following first. So let's look at the question. It's asking, you're performing the nursing process priority setting framework. The nurse should always remember to do which of the following first. So think back on what is the nursing process. It's ADPI. So let's look at our answers. Develop a plan of care, implement nursing interventions, assess the client, identify the main nursing priority problem. So which one do you think? So go back to the nursing process in your notes, and what do you think it is? Correct. It is assess the client. You always have to assess your client first. Always. Assessment, 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 assessment. I could say it 20 times, all day, every day. You have to assess your patient first. Okay, I'm going to let you do this one on your own. I'm going to let you finish this off on your own. Okay, so this is the end of the lecture. In class, we're going to go to the ATI Learn tab under Nurse Logic 2.0 and under the Priority Setting Framework. So I included it in this lecture, but you need to go back and look at that, review it. We will do a little bit in class, but just review it real quickly and we will move on from there.